A shocking trend emerges in this latest report on children in Nebraska. A growing number of minority kids are growing up in poverty.
So how can working families fill in the gaps? Maniko Bartholomew continues our coverage live with a look at how agencies in Omaha are helping. Maniko?
John and Tracy, statistics come from the latest Kids Count report. And as authors point out, poverty is one of those things that can affect nearly every aspect of a child's life. But two programs seek to provide adequate food and health care to those in need.
One moment, please.
As a receptionist, Ulysses Andrews' job doesn't appear to be too tough.
I get all the phone calls that come in, and I can actually make sure that they're directed to the proper individual.
But what Andrews finds hard to do is stretch her paycheck.
I have just enough to support me and my family, to take care of all of my bills and to put food on the table and clothes on our back.
Andrews, like so many thousands of African-American working parents, according to the Nebraska Voices for Children, is walking a financial tightrope. Higher prices on everything from groceries and gas are having a domino effect on working-class families in the state. So much so that the Omaha Food Bank stepped in to meet a need teachers observed from disruptive students.
They were getting in trouble stealing food out of the lunchroom, out of kids' lockers, and then light bulbs went off and they figured out, oh my gosh, they're stealing the food to take home over the weekend.
The food pantry now sends about 650 students home with a backpack full of food to last throughout the weekend. No questions asked. Helping working-class families keep food on the table for children isn't the only void the community is filling. They're also helping underinsured and uninsured families that may fall in that category. At the Charles Drew Health Center on 29th and Grant, doctors see about 12,000 working-class families are low-income families.
We provide health maintenance, and we talk to them about prevention, and we provide treatment. So we're keeping them from going to the emergency room. And
they do it at an affordable cost. The minimum payment here for a doctor's visit is based on income. The least, $15. The most you'd pay to see a doctor, $50. Something Ulysses Andrews knew nothing about, but is happy to know.
If I get sick, I just have to doctor on myself.
With photographer Nathan Jank, Maniko Bartholomew, Channel 6 News.
And to see a doctor at Charles Drew, a patient has to show proof of income. And as for the food bank, they estimate they serve 650 children locally through the weekend backpack program, but realistically, the need could be 10 times that amount.
Brian,